Today we will talk about the heart anatomy. In the another meaning, cardiovascular system anatomy. The heart is a hollow muscular organ. The type of muscular means muscle, and type of muscle is cardiac muscle. It is located in the thorax between two lungs. That means the heart is located in the chest. It has four chambers. First chamber is called right atrium, right ventricle, and left atrium and left ventricle. It has four valves. There is a valve between the right atrium and right ventricle, which is called mitral, and there is another valve between the left atrium and the left ventricle, which is called tricuspid. There is also valve between the right ventricle and the pulmonary artery. It is called pulmonary valve, and there is also another valve here between the left ventricle and the aorta. It is called aortic valve. The right side heart, the right side heart receives blood from the inferior vena cava, superior vena cava, and to drain to the right atrium, then to the right ventricle, then it will go to the lung. And in the left side, it receives blood from the lungs and send it to all over the body. The heart valves. The valves ensure unidirectional of the blood flow. It means that it goes in only one direction. Composed of endocardium with a connective tissue core. Two major types of the valves. We have atrioventricular valve and semilunar valve. Atrio means from the between the atrium and the ventricle, and semilunar valve means that like this, it has this shape, semilunar. This we will start by the semilunar valve. We have here as ventricle contract and intraventricular pressure rise, blood is pushed up against the semilunar valve, force them to open. As the ventricles relax and the interventricular pressure falls, blood flow back from the arteries, filling the cusps of the semilunar valve and force them to close. As I said previously, we have in the right side between the right atrium and the right ventricle there is valve called tricuspid valve, which is atrioventricular valve, and in the other side between the left atrium and the left ventricle there is an atrioventricular valve called mitral valve. In the right side we have valve between the right ventricle and the pulmonary artery called pulmonary valve, and in the left side we have artery we have valve uh, between the left ventricle and the aorta called aortic valve. Again, in this picture, as I said previously, the 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 right side heart receive blood from the superior vena cava and inferior vena cava to the right atrium. The blood enters the right ventricle through the tricuspid valve, which is atrioventricular valve. Then the blood goes in one direction. When the right ventricle contracts, it goes to the pulmonary artery through the pulmonary valve. The blood goes to the lung to receive the oxygen and come back again from the lung through the pulmonary vein and enter the heart through the left atrium. After that, it goes to the left ventricle through the mitral valve, and when the left ventricle contracts, it goes to the aorta to send the blood to all over the body. So the blood is going is go to is come to the heart in only one direction, like this. It enters the superior vena cava and inferior vena cava to the right atrium, enters the right ventricle, then the pulmonary artery to the lung, and come back through the pulmonary veins, enters the left atrium and left ventricle, then to the aorta and all over the body. Then come back again from all over the body to the superior vena cava. Then the cycle will begin again. Uh, so we will talk again about the location of the heart. The heart lies between the lungs in the thorax in a region called mediastinum. Again, the blood enters the heart through one direction from all over the body to the superior vena cava and inferior vena cava. It enters the right atrium, then it goes to the right ventricle through the tricuspid valve, then it goes to the pulmonary artery through the pulmonary valve, goes to the lung, then come back from the lung to enter the heart through the pulmonary veins. It enters the left atrium, then it goes back to the left ventricle, then it goes to the aorta and all over the body. The cycle begins again in seconds. Function of the heart: generating blood pressure and routinely blood heart separate pulmonary artery and systemic circulation, ensuring one-way blood flow. Heart valve ensure one-way flow, regulating blood supply, change in the concentration rate of the force match blood delivery to changing metabolic need. Function of the heart: pumping blood around the body is the main function of the heart. You should concentrate about this function. The heart working as a pump. It is the most important things or function of the heart, working as a pump. sending deoxygenated blood to the lung to be oxygenated. Sending oxygenated blood to whole body ensure that the oxygenated and deoxygenated blood does not mix and preventing blood flow of the blood. About the color, we should concentrate here in the heart. As you know, we have blood vessels, artery, and vein. The oxygenated it the oxygenated blood color always it becomes bright red, and the venous always because there is less oxygen in the vein it becomes blue in color. But here this is called artery and this is called vein. This is in general, but in this picture you see this is vein and it is red in color because it has an oxygenated blood already comes from the lung. So this is in general we have this color, and in near the heart it is different. The vein is red, bright red, and the artery maybe it comes blue. Blood supply of the heart. The heart is supplied by blood vessels surrounding the heart, like the left pulmonary artery, left pulmonary vein, left coronary artery, left circumflex artery, left marginal, left anterior descending and diagonal branches, and posterior descending artery, right coronary artery, and superior vena cava. This is the blood vessels surrounding the heart. Nerve supply of the heart. The heart is innervated by sympathetic and parasympathetic fibers of autonomic nervous system via cardiac plexus situated below the arch of the aorta. The heart is surrounded by membranes called pericardium. In this diagram, it is the shows the minor circulation and the which is from the heart to the lung, and the major circulation it have all over the body, from the superior vena cava, right atrium, right ventricle, right pulmonary artery, pulmonary vein, left atrium, left ventricle, and aortic. Aorta branches right common carotid artery, which give blood supply to the brain, right subclavian here, and brachiocephalic left subclavian, left common carotid, right and left coronary, celiac trunk, superior mesenteric, renal, gonadal, and inferior mesenteric and common iliac arteries. Here is the fetal circulation. In the fetal circulation, it is quite different a little bit. In the fetal circulation for the baby inside his mother's abdomen, there is blood supply from the placenta through the umbilical cord. We have umbilical artery and umbilical vein, which supply the fetal circulation. This picture shows the minor circulation between the heart and the lung to get the oxygenated and to get rid of the oxygenated blood. Here is the aorta and its branches. Now I will give you a summary about our lecture. We start by the heart, and here we identify the location of the heart, which is in the thorax and between the lungs in an area called mediastinum. The heart components are four chambers, which is right atrium and left atrium, right ventricle and right ventricle. Four valves, which is tricuspid and mitral, and pulmonary and aortic. And right side and left side heart and the direction of the blood. We identify the heart valves, the shape of the semilunar valve, and what is the atrioventricular valve between the atrium and the ventricle. It is in the right side and this is in the left side. And the pulmonary artery in the left side, right side of the aortic. Here is the valves, tricuspid, pulmonary, and aortic mitral. Direction of the blood through right atrium, right ventricle, pulmonary artery, then pulmonary vein, left atrium, left ventricle, aorta, and all over the body. Function of the heart. The main function of the heart is working as a pump, generating blood pressure, sending the oxygenated blood to the lung and to be oxygenated, and sending oxygenated blood to the whole body. Ensure oxygenated and deoxygenated blood does not mix. We identify the color of the blood surrounding the heart and all over the body. We identify what is called artery and what is called vein. Here, the blood supply of the heart, we identify the coronaries or coronary artery in different meaning according to the location. Nerve supply, the heart is innervated by autonomic nervous system. The membrane surrounding the heart is called pericardium. And the fetal circulation through the umbilical cord from the placenta of the mother. Here is the placenta, umbilical artery and the umbilical vein. Thank you.